Your Holiness, we also had a meditation project that I think you will find extremely interesting. While I was here with the students doing research, I come across a young man, a Tibetan monk, who had come in and had been released from the Chinese prison, and they had tortured him terribly. And when I met him, he was really suffering. He'd only been here 6 months, and you know the symptoms of trauma. You know, he wouldn't look at you. You know, he was really withdrawn. He was very hypervigilant. And I felt very sorry for this young man. I sponsored him. And I talked to Geisha about him. You know, is he going to be better? Because I was so worried in my heart for his mental health. And Geisha says, oh, you just wait. We'll work with him. He'll be okay. And so I came back again another season and yet another season. And after 2 years, I had emailed him and said, when I come this time, I'll bring you a present. And when I came into the office of Geshe-la, suddenly here comes this monk, and he's smiling, and he grabs my hand, and he says, where's my DVD player? And he was so engaged, and he was so the very opposite. Oh, yeah. And so I had seen that there was a change in his mental health. And so I talked with Geshe-la at IBD about the possibility of putting together a program for people who do not have peace of mind, who are suffering from trauma in the United States. We put together a 6-week program. And within that program, each 2 weeks we did a different type of meditation technique. Last year, the state of Ohio gave us funding, $200,000, and our population was a group of women who had been physically abused and were also engaged in substance abuse with drugs and alcohol, which they were treating their own, we call it PTSD. We sat with these women. Geshe-la came for 6 weeks, and we meditated twice a day. These are American women, a lot of them from the South, you know, who had never met a Buddhist monk in their life. And yet they sat and they meditated. And we had the results, which we did very scientifically, for you right here. And what we found was the outcome was that the afflictive motions of sadness and pain actually decreased. And the positive emotions increased of happiness, joy, compassion. But there was only one afflictive emotion which didn't become better, and that was anger. And so when I spoke with Geshe-la about that, he said, okay, we'll change our program a little bit because there's actually a technique that we can use for anger as well. So that was the good news, and we're publishing it in books out of Oxford, England, and across the United States. But now we have other people contacting us because there's really not a good way to treat this kind of suffering. We have the Army contacting us in terms of returning veterans in America, and we're talking about putting a program based on your meditation techniques for them. I have also been contacted by the Saudi Arabian government, the Ministry of the Interior.
Saudi Arabia.
Saudi Arabia, oh, I see.
And I also do research in Saudi Arabia. I have 2 areas in which I do research. And the Ministry of Interior contacted me because they opened a trauma center in Riyadh. And in that trauma center, they're trying to treat detainees who are returning back from Guantanamo. The monk and now the detainees. And so they're asking me to put together at the university a program that's based on these techniques that will help these gentlemen overcome their trauma and hopefully not go on and engage in terrorist activities. And so that if they can find some kind of peace of mind, then they can be reintegrated into the community there.
Very good, very good. Some scientist, some professor from America, they told me, they already used to carry some program as an experiment, selected or volunteered people, a few weeks or as a program, and each day some meditation, mindfulness as well as compassion. Before that program starts, they test blood pressure and her stress, all these things. And after a few weeks training, then they again test. So they found change, betterment, or some improvement. So that's wonderful, wonderful. Now maybe times come. Now those individual or also the institution who already engaged with such things, then some conference or some discussion, then take a different experience and mandas kaseta
Stagnations,
ka
limitations.
or limitations, discuss. Then eventually some kind of
Yes. If they can come up with something concrete document describing everything.
Then we can share with other people. Now, so they, as a result of some experience or actual experiment and research, now concrete result there. So then, now sort of concrete sort of plan or something, maybe, I think useful. But some individual is already carrying this kind of program somewhere, but not unified so far. Maybe useful. I don't know. I don't know. And then just I felt in Cambodia, so much of sufferings, problems, once happened there. So whether some Buddhist monk, whether carry this kind of program or not, if there are some monks who carry this kind of program, like the practice of mindfulness, or these things are common, Sanskrit tradition as well as the Pali tradition. So if there are some people who are doing these things, if we from Tibetan side, of course, we can't do something like university, like you, your university, I think can do. So if they have certain sort of program, with a certain experience there, might be very useful to talk to them and get their experience. And I think compassion, and with compassion, the spirit of forgiveness, and also special sort of the explanation or meditation on the destructiveness of anger, hatred. Seems, I think, the Sanskrit literature may be more emphasis. So within Buddhist own sort of tradition, that also give us some opportunity to camera.
To look for the distinctions between the different
Pali tradition and the Sanskrit tradition, and there must be something we can learn from Pali tradition, and definitely certain things can be added from Sanskrit tradition.